Stroke in the vast majority of cases is when the circulation to a part of the brain is interrupted, and depending on what part of the brain is affected will then influence as to how that patient presents or what essential disability they may have, and that could be a communication problem, a visual problem or paralysis. Now Sean, the physiotherapist, works within the community and his target would be to encourage mobility if feasible. Now for some patients mobility may not be an issue and it may relate more to the psychological effect of a stroke and that affecting their daily functioning, and that's also where Sean has been, I think, beneficial in trying to regain patients' confidence to try to move them on and achieve their functional goals.
When we have our patients who have suffered stroke, very often they're left with weakness, asymmetry, decreased balance, decreased control, decreased conditioning. And our job as a role as a physiotherapist is to increase their functional ability and mobility to an optimal level, towards an optimal level of independence. And initially they're seen in the acute setting, and then when they come to the community we see them for about 12 weeks. But then we do lots of follow-up therapy afterwards and refer on to the voluntary sector, such as the Stroke Association.
What's impressed me with Sean as a physiotherapist is listening to his stories as to some of the therapeutic interventions that he's provided. And some of that could be, for example, getting up into a tractor, because that could be a goal therapy, or for another patient he commented on wheeling logs, in the garden, in the wheelbarrow. And again, that was a therapeutic intervention with an ultimate goal. And that's what's interesting me with Sean, about some of the challenges that he has faced, but how he's overcome those to the benefit of the patient.
When I was referred back to Sean in Uri, it was 4 years ago. And in that first year of meeting Sean, he had helped me get back walking, showering, using the toilet, and fending for myself. It's been absolutely unbelievable. The man can work miracles.
It's very rewarding to be able to take somebody and increase their mobility and increase their function and increase their standard of living by providing physiotherapy. And it's a very individualised programme that we do. Very much in the hospital situation, the therapy is done to the patient. But when we get the patient home, we very much turn that around and try and make the patient and their family members expert in their own condition, with a view to them continuing on their therapy after we have finished, so that after a period of time of therapy with us, they don't come to a therapeutic cliff, stop activity and stop exercising, but continue on, and the exercise becomes part of their new way of being.
I always found him very professional, approachable, and accessible, and for me that's made a difference, but more importantly it's made a difference for the patients. And I must admit I do like discussing the patients and their progress, and I do feel that, especially with the community, sometimes their work isn't recognised as much as we would be in the acute or hyperacute sector, and I felt that he deserved recognition for the work that he has done, not just for me but also for those many patients that he has helped over the years.
He is fantastic. That's why he should get this award, because he helped me so much. It's been unbelievable.